Good morning, everyone. Today we'll be discussing Brucella, the bacterium responsible for brucellosis. Let's start with an introduction. Brucella is the causative agent of brucellosis. It's important to remember that this is a zoonosis, meaning it's a disease that transmits from animals to humans. It's a ubiquitous disease found worldwide, but it's particularly prevalent in the Mediterranean basin, including here in Tunisia. Human infection is usually accidental, occurring through contact with infected animals or animal products. A key challenge with this bacterium is that its bacteriological diagnosis is difficult. To understand transmission, we first need to look at its habitat. Brucella is a facultative intracellular bacterium, meaning it can live and multiply inside host cells. Its main reservoir is livestock, including sheep, cattle, and goats. So, how is it transmitted to humans? There are several routes. First, through direct contact with infected animals or their tissues. This can be via the cutaneous route, through broken skin, or the pulmonary route by inhaling contaminated aerosols. Second, and very commonly, is indirect transmission through the foodborne route. This happens by ingesting raw dairy product like unpasteurized milk or cheese. It's important to note that human-to-human transmission is exceptional. This means certain professions are at higher risk, including veterinarians, farmers who are exposed to calving products, and laboratory personnel. Moving on to classification. There are three main species that are pathogenic to humans, and they are typically associated with specific animal hosts. Brucella melitensis is found in goats and sheep and is considered the most virulent. Brucella abortus is associated with cattle, and Brucella suis is found in pigs. In all cases, transmission is from these animals to humans. Now, let's look at the bacteriological characteristics under the microscope and in the lab. Brucella species are gram-negative cocobacilli, so they appear as small rods under the microscope. They are non-motile and do not form spores. They are strict anaerobes, requiring oxygen to grow. A key feature is their slow growth even on enriched media, which contributes to the difficulty in diagnosis. In terms of biochemical characteristics, there are three key positive reactions to remember. They are oxidase positive, catalase positive, and importantly, they have rapid and positive urease activity. For diagnosis, especially serological diagnosis, we look at the antigenic structure. There are two major surface antigens, the A antigen, which is predominant in Brucella abortus, and the M antigen, which is predominant in Brucella melitensis. The balance of these antigens helps in identifying the species. Brucellosis is a septicemia of lymphatic origin. After penetrating the skin or digestive tract, Brucella bacteria reach the lymph nodes, where some are phagocytosed, triggering a humoral immune response. The majority of bacteria resist phagocytosis, multiply, and disseminate via the lymphatic and blood streams to organs of the reticuloendothelial system, lymph nodes, liver, spleen, bone marrow. This dissemination causes a bacterial infection responsible for indolent fever. Brucella bacteria are persistent intracellular bacteria that can lead to multiple secondary infections and delayed hypersensitivity. The clinical presentation of brucellosis can be divided into three main forms. First, acute brucellosis, also known as the septicemic form. Patients typically present with undulant fever, a fever that comes and goes in waves, profuse sweating, and generalized pain. Second, if the infection localizes to a specific organ, we see subacute focal brucellosis. This can lead to complications like osteoarticular infections affecting bones and joints, endocarditis affecting heart valves, or neuromeningeal involvement. Finally, if the infection persists, it can become chronic brucellosis with symptoms lasting for more than a year. Diagnosis can be direct or indirect. For direct diagnosis, we aim to isolate the bacterium. The most important and commonly used method is the blood culture, which must be kept for a prolonged period due to the slow growth of the bacteria. In some cases, we might also culture bone marrow or lymph node sample, as these can have a higher yield. Indirect diagnosis involves detecting the patient's immune response, specifically antibodies. The first test we often use is the Rose-Bengal test, also known as the CAR test or buffered antigen test. This is a rapid agglutination test. It uses a Brucella suspension stained with Rose-Bengal dye and suspended in an acid buffered medium. This test detects IgG antibodies. A key point is that it typically becomes positive around 3 to 4 weeks after infection. The other key serological test is the right serology. This is a slow tube agglutination test that uses a Brucella suspension killed by heat and formaldehyde. Unlike the Rose-Bengal test, this one primarily detects IgM antibodies. It becomes positive earlier from day 10 or 12 of acute brucellosis. A diagnosis is considered when the titer is greater than or equal to 1 per 80 or 120 international units per milliliter. This table summarizes the usefulness of the different diagnostic methods depending on the stage of the disease. In the acute stage, blood culture is highly useful. In the subacute stage, blood culture becomes less useful. The right test remains very useful and the CAR test becomes more useful. In the chronic stage, blood culture is usually negative. The right test is moderately useful. The CAR test is also moderately useful. However, other tests like intradermal reaction to melittin become the most useful. Finally, let's discuss treatment and prevention. The standard antibiotic treatment is a combination of doxycycline and rifampicin. It's crucial that this treatment is prolonged, typically for 6 weeks or more, to prevent relapse. For prophylaxis or prevention, the main strategy is controlling the disease in animals. This involves screening and culling infected animals. We must also implement preventive measures for exposed professionals, such as using protective equipment. And it's important to remember that brucellosis is a notifiable disease, meaning cases must be reported to public health authorities. Thank you for your attention.